So that depends largely on what you choose. Everyone who does the chip will get what we call pharmacogenetics results. These are how your genes influence your reaction to certain types of medications. If you choose, you can also get information about medically actionable predispositions, or we call them MAP results. Those are about 59 genes that can cause a wide variety of health problems. Things like heart conditions, different types of cancer, sometimes even bad reactions to anesthesia. And we look for those because we know that if we find them, there's something we can do about them. The pharmacogenetic side looks at several classes of drugs, primarily things that help manage depression, pain, things like cholesterol medications or statins, blood thinners, even some medications that we use to help treat cancer. For drug interactions, the test won't be able to tell you things like, will I be allergic to this drug? Will I have any side effects from this drug? Or will this drug absolutely do exactly what we intended it to do? It sort of helps us move closer to the goal, but it's not 100% all the time. What we look for is 59 genes that were recommended by the American College of Medical Genetics, that if you find these when you're checking people's genetics, you should let them know. These genes cover a lot of hereditary cancer syndromes, things that put you at a significantly higher risk for cancer just because you have a change in that gene. Colon cancer, breast cancer, different types of pancreatic or kidney cancer. There are also things for heart conditions. Some of those are things like high cholesterol, or differences in how your heart beats, or differences in how your heart muscle is structured. And then some of them are reactions to medication or reactions to anesthesia that we know can be very bad, as opposed to the PGX, where it's more a higher dose or a lower dose sort of thing. So if you have, as far as the medically actionable results, if you have an uninformative negative, that's probably not going to change your care a whole lot. We've checked off a list of some of the higher risk things, but that doesn't mean that we're not going to still recommend mammograms at a certain age or keeping an eye on your cholesterol. If you have a positive result, we have a system built into our electronic medical record that actually reminds your doctor, hey, this person had the genetic change for breast cancer. They need to have a mammogram every 6 months or every year, and it will remind them periodically. We call it our genomic indicators, and we have those built to keep sort of reminding providers, don't forget to check this person's cholesterol, or remember they have this gene, they need to have their heart checked every year. Yes, likely it would still be valuable. There are a lot of conditions that the chip looks at. In addition to medication interactions, it looks at about 59 different genes that can cause a wide variety of health conditions. So even if you've already been diagnosed with one of those 59 genes or one of those health conditions, it could still be helpful if that would be useful information for you. We have a lot of patients who call and say, hey, I have a question about this. Is that included on the chip? Or would the chip give me that information? And if they have questions about things that the chip wouldn't necessarily cover, we recommend that they chat with their doctor and see if talking to a clinical genetic counselor might be helpful, or talking to a cardiologist if they have a family history of heart disease. Because sometimes the chip might be useful, but if you have a family history or if you have concerns about something specific, it might be worth sitting down with a provider or a genetic counselor who works in that field and saying, here's what my concerns are. Is there anything I can do about that?